Good afternoon, everyone, and welcome to the Improvement and Innovation Showcase on Workforce Sustainability, Building the Future of Healthcare. My name is Isla Boyd, and I am the Strategic Lead for Workplace Wellbeing Partnerships here at the CEIH, and it is my absolute pleasure to be hosting the session today. Before I start, I'd like to acknowledge that CEIH is based on the traditional lands of the Kaurna people and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region, and their cultural and heritage beliefs are still as important to the living Kaurna people today. I'd also like to extend my acknowledgement to the other lands that people might be joining us from today. So before we start, just a little bit of housekeeping. For this session, it has been preset to keep your mics on mute and your cameras turned off by default. However, we will enable that for the Q&A session after the presentation. It's only this presentation part that will be recorded and published, and we will stop the recording for question time. So we welcome you to engage with us via the Q&A function and use your mics or the chat or your videos to ask your question. We'd love to see your faces. Before we kick off with the Q&A, there will be a quick survey that we would really appreciate you completing just to help us assist with evaluation and to improve these sessions moving forward. So for those of you that are unfamiliar with the Commission on Excellence and Innovation in Health, or the CEIH for short, we are the lead agency for innovation in healthcare in South Australia. And we love bringing together consumers, clinicians and other collaborators together to turn ideas into better healthcare. So our vision is together creating health and prosperity for all. To do this, we're supporting the sector to come together to imagine new ideas for better healthcare. We also acknowledge that better isn't always excellent, but we're committed to measuring what we're doing so we can understand what impact change is having. So what if the big idea was actually connecting all the small ideas? That is the essence of why we host these showcases. So it's about helping to connect people in South Australia and across our sector and nationally, and to provide a space to explore what others have learnt. And it's about sharing ideas, improvements and innovations. During these series, the sessions are approximately 40 minutes and will be made available online following the end of the series. We aim to keep it fairly simple and share work happening across the sector at any stage or any level of success, not just waiting for work to be complete and ready to be polished and published. So we focus on work predominantly in South Australia, but every now and again we like to share a showcase of ideas happening and work happening outside our state to ignite new ideas here. So just a quick prompt, if you're having a problem or have had success solving a problem, whether you've learned something or you're trying to do or you'd like to see something explored, please get in touch with us on the email that's on the screen now and just give us a shout if you've got a story to tell. We'd love to hear from you. So without further ado, I would like to introduce the theme of our 17th series, which is Workforce Sustainability, Building the Future of Healthcare. This is a particularly important topic for us at the CEIH, and as such forms one of our core strategic directions. We're committed to putting people at the centre of everything we do. And as you all know, our workforce is the central pivot to our healthcare system. Our system relies on a strong and sustainable workforce to deliver safe, high quality care. So supporting our workforce is not just critical, it should be foundational to everything that we do as a health system. However, it is multifaceted and it is complex. It is not easy. We could have easily included way more than just 4 sessions on this topic. And in fact, I wanted to, given the breadth of what drives workforce sustainability. But we're excited to showcase a diverse range of initiatives just over the next 4 weeks. So across Australia, approaching workforce sustainability from a different angle. If you haven't registered for the other 3 episodes, I encourage you to do so via the QR code and down the bottom right or on our registration page. And we'll also post a link in the chat after the Q&A. So now it is my absolute pleasure to introduce our speakers today, Jodie Bowman and Kieran Higgins. Jodie is a registered nurse with over 30 years of experience in nursing practice and clinical leadership. Her background spans health promotion, nursing informatics, rostering, aged care management, and serving as a director of nursing across a number of country hospitals. After relocating to Adelaide, she joined CEIH's Workforce Wellbeing Partnerships team, tackling processes and actions to protect and promote the health and wellbeing of healthcare staff. Jodie has recently deepened her expertise in good work design, applying these principles to the healthcare sector. Kieran is a registered psychologist and psychology PhD student interested in advancing healthcare worker wellbeing. Kieran's current research is seeking to validate a model of workplace wellbeing with clinicians in the healthcare sector, with a focus on evaluating the effect of organisational factors on burnout risk and its links to clinical performance. Kieran has had almost a decade of experience in public sector human resources, however, returned to the light side of people at work, and his current work at the Women's and Children's Health Network addresses the non-clinical capability of WCHN's people, which focuses on engagement, psychosocial safety and workplace wellbeing. I will now hand over to our speakers.
Thanks so much, Isla, and also a big thanks to Kieran for joining me today, so we get to talk about our exciting work that we've been doing together. So a bit of a rundown, a quick look at what we're looking at today. So first of all, we're going to have a quick dive into the CEIH's Sustainable Healthcare Workplace Wellbeing Framework. And then we really want to be able to walk you through what it is that we've been doing together between the CEIH and the Women's and Children's Health Network in a partnership approach to workplace wellbeing. As part of that, we've also been undertaking an applied research project, and it's called Leading East Towards Workplace Wellbeing. So we'll have a bit of a look through the stages of that and the steps and what we've done around that. We also want to then finish off at the end having a look at the implications for future implementation and also research in this area. Firstly, the CEIH has been inspired to look at workplace wellbeing differently. Traditionally, workplace wellbeing programs and projects have been focused on individuals and their own personal wellbeing. From there, it's been about how to increase their resilience to help them better cope with stressful work environments. So the aim of what we're trying to do is to look at how we could change the environments and the stressful work to make it less stressful. And we'll look at doing that through work design and also engaging staff in a co-design process. So in 2022, the CEIH conducted a synthesis of national and international literature to gain a deeper understanding of the evidence-based factors that underpin a healthy and safe organisation in healthcare. So pulling in on theory from workplace wellbeing, change management, work health safety, continuous quality improvement, and clinical governance, and also drawing on the CEIH's knowledge and expertise of the South Australian healthcare system. My colleagues here actually authorised a framework to support healthcare organisations to build sustainable structures and processes to address the work-related factors that impact on staff wellbeing. Hopefully in the past you may have seen Isla present on this, and if not, you can go into the CEIH website and find one of the previous showcases on this Workplace Sustainable Guide. So as you can see from the model, it is about looking at workplace wellbeing differently, and it is that opportunity to do top-down and also bottom-up approach. So the framework does identify the importance of that top down and ground up, but we'll start to talk more about that as we look at how the model has been implemented at Women's and Children's. So with our work, we have been able to connect with quite a number of people across SA Health workforce, places, organisations, networks, collaborating and working together. And we had an opportunity through working alongside Kieran in a number of different areas where we had that shared inspiration around looking at workplace wellbeing differently. So there was an opportunity for us to come together to consider how we could support the improvements of employees' experience and wellbeing at work through the implementation of a collaborative workforce wellbeing project. So part of that was the opportunity to operationalise and measure our workplace wellbeing framework. And part of that was also an opportunity to work with Kieran around validating a new measurement tool called Leading East to help predict the risk of burnout related to some of the dimensions of work. And there were 10 in particular that we focused on. Having a partnership was really good in the way that it enabled us to leverage capability and capacity of both organisations. And we were able to then look at how we could do it in an applied research perspective. Do you have anything you wanted to add there, Kieran?
Yeah, and hello all. I think it's an acknowledgement too that in our state, but there are lots of little pockets of excellence, and it represented an opportunity to look at what had already been done, and sort of being able to connect with yourself, Isla and Katie from the CEIH, and look at what has been done to date, so we're not sort of rehashing what's been done, and to look at how can we extend upon that, and put it into practice in a new way. And I think for me, offering into the partnership was the measurement aspect, but also an opportunity to test out the methodology that the CEIH has published, which I think is a good one. I also think too, we've talked a bit about the conscious decision to enter into a formal partnership between the two institutions and what that represents, and the commitment that serves. And I think that sort of elevates it from rather than sort of just being a general collaboration project. There are some other points of responsibility and accountability and standing that come with actually entering into a formal partnership between the two institutions, which has been a great positive.
Yeah, so I might get you to have a look through and talk about the objectives of our research project.
Yeah, so we've got Human Research Ethics approval through the Women's and Children's Human Research Ethics Committee to conduct the research on site at the hospital. What we've got quite a few research objectives. These are the primary objectives, in which I'd probably boil it back down to two from this. One, we're wanting to validate the measure. We've put together this Leading East measure, which is a measure of aspects of work, and the intention or the goal is to validate that measure, and that to see if it can function as a diagnostic, an organisational diagnostic that operationalises modifiable work design and support factors that may predict burnout risk. So looking to take that shift from, instead of asking people about the health outcome of how burnt out are you or where is your well-being at, is like, how can we actually develop a measure and validate a measure that can reliably predict burnout risk whilst controlling for individual variables, which kind of serves to evidence that work is the significant predictor, or aspects of design or modifiable aspects of work is the thing that we need to concentrate on more. And I hope that through that we can restore value and meaning to individual health promotion programs such as resilience and mindfulness. Through the project as well, we want to determine what are the main factors affecting a group, so that we can better inform what do we need to do to ameliorate or improve those things. And the goal is that we do that through a process of co-design where we engage with workers to actually understand from them, like, okay, what is the issue, but also how would they fix that issue? And does it look different across different groups? The research would suggest that just changing a unit or a team, the same issue or the solution to the same issue ostensibly could be quite different. So then at a point, we'd like to be able to evaluate how does this CEIH methodology go in practice, and why, to further look at qualitative evaluation. So not just looking at quantitative successful measurement, but qualitative evaluation. And what we'd then also like to do is evaluate the performance benefit, that wellbeing isn't just making people, like, quote unquote, feel better, or it isn't something that you just do when you've got spare time or interest. It's actually understanding that if we want to provide the best care to those that we see, we do that through having a well and engaged workforce. And that isn't just about them being individually well, but that we've got good work design and good supportive elements in work. So big goals, big objectives, and I hope that in the future we'll be able to report back and share more on those.
Yeah, definitely. It is still ongoing and a work in progress. So when we started out, we adopted the CEIH model and started to implement through each of the action levels. So starting off, as you can see here, we set out a time frame, and we did this across 2 divisions, clinical divisions at the Women's and Children's, that we implemented our project. So we started off with governance and setting that up and establishing that as per our guide. Then we worked through assessment, a process for what we call ask and listen, and we'll talk more about that as we go. Co-design to innovate and redesign work. And then obviously looking at how we made this all sustainable and for us to be able to evaluate the effects of what we did. So as you can see there, we sort of had some very quick timeframes around all of this. And the project started in December 2024 and is continuing till December 2025. So if we looked at governance, it was really important for us, obviously, as we discussed before, about having a formal partnership. And we had a bit of a discussion right at the beginning about our organisations partnering together, or are we just delivering a project? And the decision was made that we wanted to make sure that we did have a partnership so we could really utilise both of our organisations for the benefit of delivering a project, but also for what else it might bring around that. It also meant we had executive sponsors, and that's been really important for us along the way, to have executive sponsors who offer up the opportunity for focus on those sorts of things. So it establishes that there's a real commitment, but it gives permission. So it gives permission for each of the organisations to have dedicated time that starts to focus on these things. We organised to have a steering group, and that was also really helpful in terms of the CEIH Workplace Wellbeing Guide, where we link in the capability of all of the different parts of the organisation. And one of the really important things for us is that, and Kieran can talk about this as well, is that, you know, workplace wellbeing is not just an HR issue. And as we've discussed before, it links into our quality. You know, our staff, as Kieran has described, are providing better quality care when they are feeling well and feeling engaged and inspired at work. And so we were able to then create a steering group that brought in our work health and safety, our quality and safety, our leaders and our executive together, as well as people who are on the ground and that were able to contribute and help with the project. But also offered up that real ground up sort of perspective into what it was that we were doing with that governance group. Along the way, it helped us with our capability building as well. So we were able to continue to talk about looking at workplace wellbeing differently, looking at design of work, and also, you know, all of those parts that we're starting to talk about of how we make things sustainable into the future. So the next part was around assessment. And as you can see here, we did have a Leading East staff survey that Kieran has spoken about, as well as one of the things that was really important for us was also to consider organisational performance data. So really starting to look at things that help us to understand the costs of not looking at workplace wellbeing, what it is that potentially we could measure that by, if we could evidence that by redesigning work and doing that in a process with staff, that we might be able to see changes in some of those performance indicators around sick leave and turnover, patient outcomes as well. So we also had a piece of our research that was starting to look at the business data, so that we could start to put a price as well on what it was and a positive impact that we could create through that. So I'll hand over to Kieran just to talk a little bit about the 10 factors that he has in the Leading East Perception Survey.
Thanks, Jodie. So the common question is like, what is Leading East? Why East? What does it mean? Does it just mean we want to be more like the Eastern states? There's been all sorts of queries about the convention. To give context, this work came out of our staff survey process, and the questions I was receiving from clinical leaders was, I want to support the wellbeing of my team, but I don't know what to do. I don't know where to start. I don't know what I need to focus on. And so that's where this interest in developing an organisational diagnostic came from. It came from our clinical leaders and people on the floor. I think in the public sector and workplaces, you need a catchy acronym and ideally a catch cry. And for me, coming from a more HR background and a background in organisational psychology and human factors, my interest is on the work and the work environment and how are our people impacted by that. And the research is a bit more around an 80-20 split, which we conveniently line up to through these 10 dimensions, which are the circles in the middle. So East is a representation of engagement in a role, awareness of the environment, support with others in the workplace and from leadership, and then we call it transformation of the self. And the idea is that where you find deficits in a particular area, there'd be particular organisational responsibilities or people and culture processes that could be enacted to assist potentially in the recovery of a deficit or maintenance of a strength. Looking at it, it's not just about deficit recovery or improvement, it's also understanding like what are the good bits about work. So, in looking at this and developing the quadrants of how we think these dimensions would line up, we came up with East. And the idea is lead East. And the catch cry that we hope it provides for our leaders moving forward is like, I want to support the wellbeing of my team, but I don't know where to start. And the idea is lead East. If we've proven or evidenced that these dimensions and as a whole, they're functioning as a statistically significant predictor of burnout risk, and these align to our organisational responsibilities as an employer, it's going back to doing our core aspects of business well. And so hopefully lead East is a catch cry, and that's where that convention comes from. And our primary analysis at the moment has been looking at the validation of the 10-factor structure of the 10 circles that sit around the compass, and the compass, playing on the analogy of direction for leading East. So that's just to give you a bit of context around what we're looking at. And I think at the moment that's looking promising.
And the exciting thing is that in the future, we're going to get Kieran to come back and talk about this after he's finished all of his validation and work around that. And as I discussed before, we also were looking at organisational performance data analysis as part of the project. So as Kieran sort of alluded to, one of the things that we often find when we're out is, but how? People know that something needs to change around workplace wellbeing. Our staff are under enormous stress, our healthcare system's under enormous stress. People know that we need to do something about it. The question is how and what. So the next part of our redesigning work project was around a process that we call Ask and Listen. And this was our process for engaging with staff to help identify what it is around their workplace that impacts their wellbeing. So we'll have a little bit of a dive into this. Was really this great engagement process to begin the project, and it is the first stage of our team level action in the Workplace Wellbeing Guide is the Ask and Listen. So as we talked about, this is the first stage in that team level action from the CEIH guide. It was the staff engagement process to help empower teams to identify what influences their wellbeing at work. So one of the things about that was that the process of doing that was really interesting in establishing ourselves. So some of the things that we found out of that were taking whatever opportunities that we could to engage with staff. And even though, like we spoke about before, we had great engagement with executive and commitment from leaders for staff to engage in the process. But saying that and then understanding as well as you all would in a healthcare setting, it's really hard to be able to engage with staff in a time where we could take them away from providing care and take them away from other things that were really important, like education and things like that. What we were able to do was to link into some of those education sessions, that double staff time and those sorts of things where there wasn't anything actually planned, and we were able to jump in and do those sessions with staff. We learned very quickly that we had to be really flexible and take every opportunity that we could. So the way that we run Ask and Listen was to grab staff, so from an amount, small groups through to larger groups, whoever was available and what we could do. All staff were invited to attend. So we put the invitation out to anyone, administration, physiotherapy, medical, nursing, and predominantly we had nursing and medical engagement. We did manage to get other people along as well. And we asked them 5 questions to help capture the areas of work that either positively or negatively impacted their wellbeing or stress at work. One of the key things was really to also make sure we asked the positive. That was a really important thing, and it was a great way to start a conversation as well, is to speak to staff about what positively impacts them at work. So as I said, we had to be really flexible. We did sessions really early in the morning. We did sessions on night shifts. And we took opportunities where we could. So we kept it really simple by having just sticky notes and butcher's paper. So staff could simply write down their answers and whack them on pieces of paper really quickly. So some sessions went for 5 to 10 minutes where we gathered as much information as we could. And some sessions sort of went for that half an hour where we really got to engage with staff and go into a bit more depth. One of the really key and important things around that was ensuring psychological safety. So we really made sure that we grabbed groups of like peers together to do that, where people felt safe to be able to provide their thoughts and ideas. They didn't necessarily want to do that in other people if they thought it might impact them. And it was exactly the same for our leaders and other people that we involved as well. So we did do sessions with our managers as well to try and grab it from their perspective around their work and what was positive and negative for them as well. The sticky notes also help with that psychological safety because there was no information in any of those sessions that we gathered that was identifiable. So writing quickly on a sticky note meant that people felt safe to then contribute. So out of our Ask and Listen, we moved through fairly quickly into a co-design process. So going back to staff with the themes of what it was that we heard in Ask and Listen. It was really important for us as part of the project team that we responded really quickly and that we did what we said we were going to do. So when we did do the survey, as Kieran described, you know, we're asking people to do another thing, and people do have a bit of a negative response sometimes to surveys because in the past they've done a survey and never necessarily seen the results or heard about what has been done about the results. So it was really important for us to be able to say, we've heard you and we're coming back and we will be here in a quick time frame. So we weren't going to leave things for a long time. Sorry. So as we talked about what we heard in our Ask and Listen, we then took all of that information and we got quite a lot of information. Staff were fantastic in contributing to help us identify what were the prevalent themes, what was it that we heard, and how did we, you know, go about then categorizing and triaging all of those things. So we looked at what was really prevalent and we looked at those things that staff had identified had the biggest impact on them and their wellbeing. So we then put out those an invitation to staff to come and join in some co-design sessions around those prioritised themes. So the next step was then the co-design sessions. So again, it was really important for us to hold those sessions as flexibly as we could to allow as many staff as possible to be able to contribute, and particularly those people that were really passionate about the theme and what it was. As part of that, we also made sure that we included subject matter experts, so other people that could offer in the perspective for staff. So whilst this was a ground-up approach, it brought in other people as well, and those subject matter experts were able to talk about legislation, other parts of the business, things that the staff needed to consider in how they redesign their work to make it effective and localised. So it was then specific to each of the areas and each of those groups of staff. So we did need to obviously ensure that psychological safety again. And again, we went back to making sure that there was nothing identifiable about the people that were attending the sessions. We asked questions. So we moved through a series of questions that looked at what was currently happening through to if you had a magic wand or, you know, blue sky thinking and think creatively and innovatively about how it could look in a perfect world, through to then what could we do and how could we redesign work for that group and for that particular sort of theme or that particular work factor. So how we could then redesign it into practice. And staff were amazing in being creative, but also in being very, very practical. So our co-design solutions were then brought in, and we captured all of those, and they were all presented back to divisional leadership, to the steering group, and also through to executive. So Kieran, I guess from your perspective then, you know, there was a lot of information and there was a lot of themes that then we had to present in a way that was tangible for women's and children's.
Yeah, and I was just going to jump in and share that one of the goals of the project outright was like kind of cost neutral, no cost, where possible, and without going into, you know, the findings as such now, it was just interesting that the vast majority, almost all, were, in my opinion, like relatively readily accessible, no cost solutions. Clinicians, when they're looking at solving their problems, he was actually looking at it in quite constructive and tangible ways. You know, some harder than others, which reflect the pebbles, rocks, and boulders view of the CEIH. But I just think it's really interesting to see that play out.
Yeah, and thank you for mentioning pebbles, rocks and boulders. So that is something that we refer to in our guide from the CEIH, and it's a way of helping us to classify where some of these solutions sit. So looking at pebbles as being the things, you know, the pebbles in your shoes, the things that are everyday that could really be fixed at a local level. Then looking through to rocks, which are a bit bigger, and that might be more at a divisional level or across more of the organisation. And then our boulders, which are more of those either network-wide or system-level things that are going to take a lot longer for people to be able to solve or create solutions. But that we wanted to make sure that we didn't lose all of that really valuable information as well. So certainly when we had all of these solutions, we made sure that we addressed what was really important, but also what we could do at all of those different levels. So lastly was sustainability and evaluation. And as we talked about, we probably haven't reached the position to be able to talk about evaluation just yet. But certainly from a sustainability perspective, what are our opportunities for action moving forward? So one of the things was around having a wellbeing group that can drive work design change as an ongoing activity. So one of the other things that we also found was, as you will all be aware, most of you have plenty of meetings already in your calendar. So if there is actually meetings or groups that are already meeting that can champion this and take on that for sustainability into the future, that was really important because people's time is really valuable. And if there's a group that's already existing, it was really good to be able to link into that. We certainly noticed that there's opportunities for sustainability in the future by improving workforce data to enable managers to understand and be able to analyse in one place. There was certainly lots of data, as we know, in our healthcare systems, but none of it sort of was linking together, and it wasn't necessarily measurable with each other around some of the wellbeing parts of that. And Isla certainly has been very well engaged across the system in improving some of those KPIs and workplace wellbeing data. So watch this space. Resources, thinking about in the future who you can grab in to help to support wellbeing initiatives. As we said before, it's not just an HR issue. And if you can grab all of those people to collaborate together, it increases the capacity of your organisation to really focus and target on workplace wellbeing. Some of the other opportunities around how leaders can prioritise wellbeing and work design activities. So some of the common things we heard at the end of this was certainly from staff that they really enjoyed having a voice and they really enjoyed being engaged in how they could design things differently. So how can our leaders continue on with that and engaging staff into the future? What are ways that we can continue to hear from the staff who are working this every day, who are experiencing this every day, to be able to contribute into the organisation to say, these are some things that we think that could be done differently. And one of the things that we know is that you know, if we redesign work and improve efficiency, that's only going to be better for the organisation. And again, thinking about how that co-design can work and be part of a new way of working in your organisations. I'm going to hand over to Kieran for ongoing thoughts around future research and practice.
Thanks, Jodie. Yeah, I think for us, the work that we've done really sets up a shift in how we sort of talk about what is wellbeing. I think wellbeing runs the risk of being a bit of a dirty word, particularly in healthcare. It's an umbrella term. So for me, I've even narrowed down to really be focusing on burnout risk and what are the specific measurable drivers of that. I think this process is also really sort of illustrated to me the real importance of quantitative and qualitative coming together. It's one thing to get quantitative insights, have validator tools and developing validator tools, but we need to also capture the why or what is driving that. And I must admit, some of the insights we got from our people when we get to talk to them are really rich insights. But I also think balancing that with a clear methodology is also really useful to manage our biases or self-interests. So I think that's something really useful. And being clear, I think what's been really interesting in this process or project is, pre-planning, not just what we're asking, but being really clear about the why. What are we expecting to find? Is it exploratory or is it directional? And, pre-planning, what would we do? Not just from a distress perspective, but what would we do with that? I think that there's a really strong sentiment in a lot of organisations that we run these staff surveys, but what do we do with the information? How is it used? Or are we just asking again? And I think that's a really big point of responsibility that we have to restore meaning to these processes. I think for me, I'm really keen to sort of see us challenge some of the healthisms that I call them affectionately, that I think exist in the design of work in healthcare. I'm still comparatively relatively new to healthcare, but I just can't help but feel that the inherent design of some aspects of work are causes of systemic stress or burnout risk. So it's also then trying to understand, like, okay, how can we better control for that? What is there an appetite to modify or have a look at, and what are we stuck with, and why? How do we close that conversation with our people? I think the other, I use the term cool thing, is that we are better positioned through this work to better evaluate changes over time and to sort of build that shared responsibility as an employer with our staff. And hopefully that restores some meaning and purpose. Even when I look at the staff surveys, like I say I'm guilty of just going, oh, it was only 20 minutes to fill out a survey. That's quite a long survey. And when I look at the amount of people that filled it out for us, it kind of equates like 20 days of work. And so collectively, through asking our staff to fill out this one thing, we actually took 20 days of work off the floor. And that was on the basis that it was approved to be done in paid time. So it's also just understanding, like, these one little things that we ask of our people, they add up. So I think it's also making sure, like, part of our goal from a validation perspective is, tool parsimony, like reducing down, so that we are just maximising the time of engagement with our people. So I'm really interested to see what we can do moving forward. I'm keen to sort of, I think the biggest implication is it's really sort of anchoring a shift to design of work, and the role of the design of work and redesign of work, rather than an over-reliance of trying to drive or build resilience, which is also really important. Like, it's a really strong protective factor, and I think for me it's actually how do we restore meaning to those conversations by attending to other issues affecting work groups. So that would be my primary summary at this point, and I hope that we can come back and share in the new year more about the tool and whatnot, and what we've done to do that, because I do think that's quite a strong process, and I do acknowledge that this program has been well supported. I've been very well supported by our CEO, and we've been very well supported by the executive group to do this work. So I hope that at a point we can continue to share, and hopefully others can take what they want to learn from it. And we're not finished yet, so there's still a bit of work to go.
Thanks, Kieran. We'll hand back to you, Isla.
Thank you so much, Jodie and Kieran. That was absolutely fantastic. And I think having been intimately involved in the project, it's been a lot of work. It's certainly been a ride, but yeah, certainly the start of something great. So thank you very much for all your efforts and for sharing that with us.